hosts, and we are super excited. We are actually on the road. We took the Wellness Foreplay podcast on the road. We are in Silicon Valley, Northern California, specifically Fremont, California. In fact, this is home of the Tesla Motors assembly plant. It's literally right down the street where all the Teslas come from. We're just super excited to be here. I was born and raised in the Silicon Valley, so it's home for me, home to spend time with family for Easter.
Yeah.
But we're excited. We've got a great episode today.
Yeah, we do. So I'm a former police detective, and
I'm a former family wellness chiropractor.
And so we're bringing our expertise together so that we can do the investigations that we know will bring you the knowledge that is the foreplay to your wellness.
Yes.
Because we all know you want to be well, right?
Right.
Absolutely.
You should want to.
Yeah, I know I do. And you know what I just realized too? So today's episode 20, and it's all about posture, the window to your wellness, okay? But I just had this just aha. It's like, this is actually where we are right now. It's where you got your start in really learning about this topic.
Yeah.
Well, it's here in Northern California. So hi guys, it's so good to have you on here with us live. By the way, we are live right now, 3 different places on Facebook. We'll be recording this, uploading it to YouTube so people can go and watch it there, as well as using the audio for our podcast. So go and rewatch or share this out to all of your friends, because wellness is such an amazing topic and people want it more now than ever before.
It's more important now than ever before. People are realizing whether they have it or not.
Yeah, definitely. So episode 20, the way that we do this is we always have one topic. Today's posture, the window to wellness.
Yes.
And we answer 4 specific questions about each topic. So today's questions are, first, what is posture? Second is, why is having good posture so important? Third is, what does having bad posture feel like? So really pay attention there, guys. And if you're feeling these things, you'll want to look into your posture. And then number 4, what can be done to improve posture?
Yeah.
Okay. So are you ready?
I'm ready.
Yeah. So I absolutely love this topic because, first of all, it's your expertise.
It is. It's my jam.
Yeah. So I'm excited for the information that you're going to be able to bring to everybody that hears this and is watching us now, because it really is so very important.
It is.
I know I got mine started, in what we're talking about today, when I was 13 years old. So the sooner you can really start learning about this, even the better.
Right.
So question number 1, what is posture?
Do you want to read the definition, and I'll tell you kind of the practical application of it?
Yeah, sure. So posture is the position in which someone holds their body when standing or sitting. So that's the definition of what posture is.
Yes. And posture is literally how you show up, how your body is doing what it's doing, how well it's working, how efficient it is, or how inefficient it is. It all, and I say all, I mean all, comes down to posture. And it's how your body, and think about it, we live in a very mathematical environment. Everything is horizontal and vertical. It's a kind of our frames of reference. So we have the horizon and we have vertical reference points. So for printers, even printers are on this. Do you want to do it portrait or horizon? So it's just a matter of looking at your posture. How it represents you is how it represents the function of your body, and look at it in right angles. So from your level of your shoulders, the level, the bottoms of your ears, the tops of your pelvis, your knees, the center of your knees, everything looking in horizontal reference points, and then everything in vertical reference points, and how it relates to your overall posture. We'll get into the details of that and why it is so critically important to your overall wellness. They say that your eyes are the window to your soul. We've all heard that. Well, posture is the window to your wellness.
Yeah, and you can definitely have good posture, and you can definitely have bad posture. So we want to make sure that we help you with some identifying factors as well. So why is having good posture so important? That's question number 2. I got to tell you, I learned early on in my life having good posture was super important. I was an athlete and I actually grew really, really fast. And so I learned that because I grew like 6 inches in one summer between 6th and 7th grade.
But you had some pains going on.
I had a lot of pains because everything wasn't growing at the exact same rate for me. And so I had some different pulling on my spine and on my knees and different things. And so
it's all connected.
Yeah, that's when I really started becoming aware of the importance of posture. So why is having good posture so important?
Well, just from the functional standpoint, your brain and your nervous system is your spine, your spinal cord, and the spinal nerves. Your nervous system controls everything. And so what determines how well that works is your posture. And let me explain what I mean by that. So we all understand we have a brain, and we all understand the importance of a brain, which is why we have a skull to protect it. So a skull is like a built-in helmet that protects our brain because it's critically important. Well, most people don't really think nearly as often as what protects our spinal cord. And the answer is it's the bones of our spine, the 24 bones of our spine. We have 7 bones in the neck, 12 bones in the mid-back, or what is called our thoracic spine. And then we have 5 bones in the lower back, the lumbar spine. Those 24 vertebrae and the alignment that they have, the posture that you have determines the alignment they have. And that also determines whether or not and how efficiently they are protecting your spinal cord, which is how important is the spinal cord? Well, if you've ever seen somebody have a neck injury, they become a quadriplegic. When the brain can no longer communicate to the body through the spinal cord and spinal nerves, those things stop working. We call that person a quadriplegic. A lower back injury, we call that person a paraplegic, where their lower body doesn't work. So from the brain down to where the injury is in the lower back, it's fine, but below that, it's not. So we can see if it can stop the functioning of something with a major injury. What about a slight little shift? What about a slight little misalignment? What about a slight little amount of pressure? It can have catastrophic events. It can have major impact on your health and whether or not it's expressing itself at its ultimate level. So why posture is so important is because it literally determines how well your brain is communicating with your body is communicating with your brain, and as a result, that entire communication system determines how well you are or are not.
Yeah. So basically your posture has to do with how well your spine is in alignment.
Exactly.
And your spine is protecting your spinal cord, and all of your nerves come out of your spinal cord. So if your spine is out of alignment and you have bad posture, all of those nerves can be having all kinds of additional pressure put on them.
Yes.
And nerves are like the messenger system, right? From the brain to the different parts of the body. And so if the spine is not in alignment, the way it's supposed to be, if it's shifted, it can be really kind of causing a lot of extra problems.
Right.
And I know that's part of what I experienced. The next question.
Well, think about it in just a regular example that we've all had, especially when we were kids. I don't know about everybody, but when I was a kid, we played in the hose a lot.
Yeah.
And, it was like, and we didn't worry about drinking out of the hose.
No.
It was just, you turn on the sprinkler and you go play in the sprinkler. What happens and I remember with my brother and my sister, we'd have a nice big sprinkler, and then I would just stand on the hose to stop the water going to them. And it instantly, as soon as I stood on the hose, the amount of water going through that hose to the sprinkler was diminished, and my brother and my sister got angry at it. Well, then what did I do? I took my foot off the hose, returned the normal water flow to the sprinkler. Well, we understand that example. That's exactly what happens in your spine. You have 24 vertebrae, and at every level of those 24 vertebrae, you have a left nerve and you have a right nerve. So we have 24 pairs of spinal nerves. When you put pressure on those nerves, like stepping on a garden hose, it interferes with the water coming out with the hose. It interferes with the signals going from your brain to your body and back again. Can have major problems in your overall health.
Oh my God. Okay. So you can actually have events in your life that create problems with your posture and with your spine. But then you can also, like, I've been in car accidents that have created problems with my spine that I've had to have correction, as well as the way you sleep, the way you sit, the way you watch TV. The way that you look at your phone all day long, all of these things can start creating these different problems with your posture that can negatively affect your health. And it can show up in many different ways. And question number 3 moves us right into that. Are you ready for question number 3?
I would assume I'm ready.
I know you're ready. So question number 3 is, what does having bad posture feel like? Okay, how about if I just read this list here slowly so we can kind of talk about it? Because I know I've experienced a lot of these things, not all of them, but I'm sure there are people out there that have experienced all of these and more, whether it being themselves or their children.
Yeah.
Because this does have a massive affect on children and the way they act,
or how they grow.
Well, and even how they act.
Yeah,
because if they're out of alignment, they could be little turds when they're really meant to be sweet angels.
Right.
I mean, seriously, right? So the obvious things that having bad posture can feel like, and take note of these, because if you're feeling these, we're going to give you some suggestions here in just a moment. But the obvious are headaches, back pain, shoulder pain, knee and hip pain. Often less obvious are feelings of numbness into your extremities, down in your fingers, down your arms, your shoulders, your toes. Infertility. How about bedwetting past 5 years of age? Chronic ear infections, allergies, cold hands or feet, abnormal menstrual cycles, vision problems, taste issues, and smell can decrease with bad posture, and so much more. So if you're like, yeah, that's me. Yeah, that's me. Oh my gosh, that's me too. Guys, there's so many other things that can be happening because of having a problem with your spine, a problem with your posture. And so I know that you've had some, I'd like for you to share some stories from your experience being a chiropractor and some of the people that you met along the way and the outcomes. Because I mean, I know of some of those stories and they're phenomenal.
Well, I want to start, yes, and I'm very much looking forward to sharing these stories, but I want you guys to understand, and for those of you listening on the audio only podcast, it's going to be a little bit more difficult to get this, but you just close your eyes, and if you're not, unless you're driving, of course, but sometimes when you don't have the visual, it becomes more, when you just hear the audible version of it, it becomes a little bit easier. So just imagine, so take your right hand and stick your thumb up, like Fonzie does. And if you don't know who Fonzie is, that's okay. It was a TV show back in the 70s.
Yeah, he was pretty cool.
Take your right thumb, or your right hand, put your thumb up. Now take your left hand and grab a hold of your thumb, and so that your hands are stacked on top of one another. That represents your spinal cord is your thumb. Your right hand, so the bottom hand, is one vertebra. Your left hand, the top hand, is the other vertebra. You have 24 situations just like this. So you have 24 vertebrae that handle this. Well, there is something called the 6 degrees of motion. Every vertebra can move 6 different ways. So imagine that my thumb, again, your spinal cord, this is a reference of your spinal cord, you can turn to the left or turn to the right around the spinal cord, okay? So you can rotate left, you can rotate right. That's 2 of the 6 degrees of freedom or degrees of motion. You can also bend forward or bend backward. That's another, that's 2 others. And now you can also bend to the left or bend to the right. Keep in mind what's happening to your thumb each time you do that. So follow along with me again. So your right hand, thumb up, left hand, grasp around your thumb so your fists are on top of one another. That's your vertebra. You can turn around your spinal cord, turn to the left, turn to the right. Each of your individual vertebrae does that. Now you can bend forward and bend back, but you can also bend to the left and bend to the right. Realize that every one of those circumstances, every one of those 6 motions is bending your spinal cord in some direction. Now imagine this happens 24 times all the way down your spine. Have you ever, imagine when you were learning to walk. For those of you who are parents, when your children were learning to walk, you realize how often they stumbled. You realize how often they fell down. Or how about maybe you don't remember that part of your own life when you were learning to walk, but how about when you learned how to skate on roller skates or inline skates or your skateboard or ride a bike or jump on a trampoline or do all of the things we did as kids? Imagine every time you fall down, you knock one of those bones into one of those 6 degrees and it sticks that way, or it gets stuck, or it doesn't move quite right. They can move all over. And this is an individual, however you fall, falling on I remember when I was a kid learning how to ride a skateboard, I would be riding really fast on the sidewalk and not notice it, but my tire or the wheels on the skateboard noticed it when they hit a rock and I went Superman flying off the front of the skateboard. That was never fun. It always ended up losing skin, bleeding, and developing a scab later. It's just a matter of how did my body feel? It might not have felt really bad, but or maybe I wasn't going that fast and it didn't hurt. Well, what happens if that bone fell out of place? Now let's just look scientifically. Let's dive into what scientists, researchers, and doctors talk about this. There was a gentleman by the name of Dr. B.I. Radovic found that with just 5 to 10 millimeters of pressure, which is the equivalent of the weight of a dime, a United States minted dime, the smallest coin we have, take that dime and put it on the back of your hand after you're listening to this episode. Do you feel it? It's almost imperceptible. 5 to 10 millimeters of pressure is almost nothing. Well, here's the deal. That little amount of pressure on a spinal bone that is out of place, putting that little amount of pressure on the spinal nerve interferes with the nutrients going to that nerve, meaning it cuts off its nutrition. So when you cut off nutrients, you cut off nutrition to anything. Imagine stepping on a garden hose that goes to a garden and leaving your foot there. What will eventually happen to the garden? It will be deprived of nutrients, in this case, water, and it will eventually die. How long? 2 weeks. Scientists show that after 2 weeks of this kind of pressure, just the weight of a dime on an individual spinal nerve will start the irreparable scar tissue and irreparable arthritis process. It doesn't, can you imagine when you fell off your skateboard or your bike when you were a kid and you never went to a chiropractor and had that bone put back in place? What could it lead to 20, 30, 40, 50 years later? We're talking after 2 weeks, there's irreparable damage if it's not corrected. That's how important this is. And Dr. Seth Sharpless from the University of Colorado, another researcher, found that it cut just the weight of that dime. Not only does it interfere with nutrition, the nutrients to the nerve, it interferes with the amount of information that nerve can carry from the brain to the body and from the body to the brain by up to 50%. It's a big deal. It's a big deal scientifically, and it's a big deal as far as our wellness is concerned. So how do we look at that? How do we know that that's an issue? Well, when you have nerve pressure, when the brain cannot control a certain part of the body, or the body cannot communicate to the brain its needs, we start to have dysfunction. The longer it's out of alignment, the longer the posture is interfered with, the longer that problem exists, the more likely we are going to have problems that we feel, that we go to doctors for other reasons, we take medications for, we do other things for, not realizing the root of the issue is posture related. And we can show you guys how to assess that.
You know, and this is so important, guys, because this could be the key thing to why you're feeling the way you're feeling right now. And yet going to regular doctors, you may be diagnosed with something else and being treated for something that is not even the problem. And
maybe
then
the symptom, but it's not the problem.
Right. And so
cause.
If you know that the potential is your posture, you absolutely want to be able to go and have your posture corrected to see if whatever symptom you're having will just self-correct by allowing the proper messaging, the proper blood flow, the proper nerve action to take place. I love that. So
now, I actually want to share the stories when we get into our next question.
Okay.
So we can talk about. So once we, because I want to help people understand whether or not they now. If anyone's ever told you to sit up straight, stand up straight, then you probably have some posture related issues. If it's something you hear all the time, I remember growing up, Mom, sit up straight, stand up straight, slouching at the table, slouching at the couch. Now kids, like Marcy said, looking down on their phones all day, whether they're on YouTube, they're looking at memes or playing computers.
We do it too,
Posture
guys.
is horrible.
We do it too.
It's a learned, here it is. Posture is a learned behavior. It is a learned situation. It is a learned condition based on the lifestyle that we live, and other contributing factors.
And just like any learned habit, it can be corrected.
Yes,
right?
Can. That's the good news.
Woohoo!
Yes.
That's so good. So good. All right. So that leads us right into question number 4. And the question number 4 is, what can be done to improve posture? And I love this because it starts out with you first determining whether or not you have a problem with your posture.
Yeah.
So, sometimes you can see that by the symptoms that you're.
And how to start to quantify it. Because if somebody says, sit up straight or check your posture, stop slouching, those kinds of things, it may be that you have abnormal posture or even bad posture. The question is, can you identify it? Can you quantify it? And the answer is absolutely yes.
Yes. And you actually have 2 specific home assessments
for you
that you guys can go and check out. First of all, this is like the step 1 to finding out if you have a posture issue that needs correction. And so the very first one is by taking a look at your shoes. Yeah. Right. So a pair of dress shoes. So
go into your closet and pull out, and this is for guys and gals, go into your closet and pull out a pair of dress shoes. Now for stilettos, it doesn't work. No. You have to have a good wide sole, the same width of the shoe itself. So maybe Flats with a slight heel for women, or any dress shoe for a guy will work perfectly. That you've had, not new, any dress shoe that you've had for at least 6 months or worn multiple times. Because go into your closet, get these shoes, and put them on the floor as if you were going to step into them. So your left shoe on the left, the right shoe on the right. Now pick them up in your hands and look at the soles. Compare the soles to each other. Now, just each individual shoe, it's normal for the outer part of the sole to wear more than the inner part of the sole, because that's the part of the walking mechanism. What's not normal, or what is in this case abnormal, indicative of abnormal posture, is if one of the shoes, the outer side, is worn more than the other side outer wear. So if you, and that's where you can look at them and visually compare. If one side is worn more than the other on the outside, there's a very, very strong indicator that you have abnormal posture. Now we can begin to quantify it. That would be step one. Step two, which is another do-it-yourself step, is if you have two scales, bathroom scales, compare. So put them side by side, stand on each one to make sure you get the same weight, because calibration is critically important. We don't want to be looking at what could be an abnormal posture when it's just a improperly calibrated bathroom scale. So step onto one scale, both feet, look at your measurement, look at your weight. Now step off, step onto the other scale and with both feet and look at your weight. The numbers should be the same. If they are the same down to the decimal point, so whether it's 1 decimal place or 2 decimal places to the right of the decimal point is important. It needs to be the same. So once you identify that these scales do in fact measure the same weight, you know they're properly calibrated. Now put them side by side, put your left foot on one and your right foot on the other and look straight ahead. You're going to need a partner for this. You're going to need somebody to tell you what the numbers are, because when you look down at yourself, you're throwing your cerebellum, which is the back part of your brain, which is where balance and coordination comes from. You're throwing that off and you can skew the numbers. So
well,
you have
and by
to,
looking at the numbers, sometimes you'll try to self-correct.
Yes.
Without even thinking about it.
And so that's why you can't do this by yourself. You need a partner. Left foot on one scale, right foot on the other scale. Stand there, be still, and look straight ahead, and have somebody read what the scales say. If there is a difference from left to right of more than 5 pounds, you have a postural issue. Question, and the greater it is, the greater the postural issue. And you can correlate this with the side that weighs more is probably the shoe that has more wear on the outside, because your center of gravity is off. So if you're not following closely, let me give you the real example here. So let's say somebody weighs 100 pounds on one scale, and they check the other scale, they weigh 100 pounds on the other scale too. When they put the scale side by side and they put the left foot on one, the right foot on the other, both scales should read 50 pounds if this person's center of gravity is correct, meaning if their posture is correct, under gravity, they are weighing the same. Their center of gravity is normal, which would be 50 pounds on the left scale, 50 pounds on the right. If it's something like 55 on one and 45 on the other, we've got a postural problem. Now do it barefoot. Do this barefoot. So there's no way you could have, improper, you don't want to measure the improper shoe wear and have that contribute to your abnormality of the difference of weight. Do it barefoot. That will tell you the hard sole shoes wear and the difference of the weight will tell you you're on your way to understanding, do I have a postural problem? You will know for sure. Once you get those two determinants, then it's time to take it to the next level, which is getting professional assistance with it.
Yeah. And so guys, if you are experiencing any of the symptoms that we mentioned earlier, as a matter of fact, I'm going to read them again. Quick.
They're very important.
So headaches, back pain, shoulder pain, knee and hip pain, and then some less obvious feelings are maybe numbness. If you're feeling numb throughout any parts of your body. This is such a big one. Infertility, bedwetting past the age of 5, chronic ear infections, allergies, cold hands or feet, abnormal menstrual cycles, vision, taste, and smell decrease, and even many more than that. But if you're experiencing any of those symptoms and and I don't want to say and, because it could be just the symptoms, because you could have a different type of postural problem that doesn't show up on the scales.
Right.
And so if you're experiencing those symptoms Or if your home assessment comes out showing that you potentially have a postural problem, then absolutely you need to seek out the advice and care from a professional that is trained specifically for posture correction. Okay. And this is where, I mean, this is your expertise. You know, so there's first of all, I would like for you to share your own personal story with chiropractic, how you were introduced to your first chiropractor.
Yeah.
I would love that story first, if you wouldn't mind.
Yes. Big shout out to Dr. Mark Wells, who
Say
changed
whoop, whoop.
everything in my life.
Yes.
It was the chiropractor that I went to when I was 24 years old. And I was having numbness in my hand. I was playing baseball and playing shortstop, and I was having numbness in these three fingers. So my index finger, my middle finger, and my thumb. And when you're playing shortstop and you have numbness in the tips of your fingers, you can't feel the ball properly. So I wasn't able to throw to first base with accuracy and lost my starting position. And my teammates were telling me to go to a chiropractor, have it evaluated. Well, I'm thinking I'd never been to a chiropractor. I'd never met anybody who had ever been to a chiropractor. And all I knew about chiropractors were, one, they're quacks. Two, they're not real doctors. And three, if you have back problems, that's why you go to see them. Well, all three of those I realized were myths later on. So I'd never been, nobody ever did. Why would I go to a quack? And I'm not having back pain. So after a while, after it wasn't going away, it was getting worse, figured, okay, I'm going to go. And I found this was actually here. I was at the Alameda County Fair in Pleasanton, California, and I met Dr. Mark Wells. And he had this posture evaluation machine. And he said, check your posture for free. I'm like, this is interesting. I was sitting there watching about 4 or 5 other people go before me. And he had this machine where he would look at their shoulders, the bottoms of their ears, the tops of their pelvis, and their knees. And he had this thing that he had them stand on 2 different scales, and these vertical measurements. So he would stand behind them and draw this string down over to the tips of their shoulders. And then as they stood off, so there would be whatever it represented. So, and I'll just kind of share with you what it must have been what he must have seen when I went there the first time. So my head was tilted. I had a shoulder tilt. My pelvis was off. And so when I stepped off, and I was like 17 pounds heavier on one side. And I'm thinking, this guy's a total quack. This is a bait and switch. It's smoke and mirrors. It's just, he's going to try to suck me for money. And I was very, very skeptical. And when he stepped off, and he showed me this is where the strings were, I thought there's absolutely no way. Well, the person that I was there was like, dude, you were jacked up. That's exactly how you were. And I'm like, really? So my friend's now telling me, no, what you're seeing is legit. He didn't do it. And you're standing on level ground. And he actually had a level on the ground with a bubble in between the lines. So I knew it was level. I was like, interesting. So he offered free exam and x-rays. And I had x-rays taken for free, and he examined them for free. And then he told me for the first time about these 24 bones of my spine and how important they were and the nerve pressure that was causing. Well, he looked at me and he said, you have a loss of curve in your neck. You have a slight scoliosis, which is a slight curvature when you look at the front of the spine in your mid back, and you have a loss of curve in your lower back. And over the next 6 to 8 months, we can fix this. And I'm like, yeah, sure you can. And he said, so he goes, no, I'm dead serious. So we got on a care plan. After 3 times to his office, the numbness in my hand was completely gone. Is because he started getting the bones in my neck that had, and I this 24 years old. So from the time I'm born to the time I'm 24, never been to a chiropractor, never had anybody evaluate my spine. And he asked me the question, do you ever brush your teeth? And I said, yeah, kind of an odd question. You're not a dentist. And he said, how often do you brush your teeth? I said, at least 2 times a day. He says, why do you do that? Is it because I want to avoid cavities? He goes, well, why do you want to do that? Because I want my smile to look good. He goes, why do you want to do that? Because I just do. And he says, well, have you ever had your spine evaluated? And I was like, no. He says, well, how do you know there's not anything wrong with it? And I go, well, I guess I don't. He goes, what if you never brushed your teeth in your entire life? What would you expect them to look like now at 24 years old? I'm like full of cavities. And he said, exactly. If you've never had your spine evaluated, and he goes, you can get your teeth replaced. You can get fake teeth. You can't get a fake spine, but if no one's ever checked it before, we really need to look at this. And that's when he took his x-rays and explained everything to me. I thought it was amazing, but 6 to 8 months later, the curve was normal in my neck. The scoliosis was gone in my mid back, and the curve was normal in my back. And I got my starting position back after 3 adjustments. So a week. And
part of what you missed in this story, babe, is so important, is that the doctor you had seen before this looking for help with the correction had told you that the only way to correct it.
I went to an orthopedic surgeon. In fact, the orthopedic surgeon for the San Francisco Giants and the San Jose Sharks. So the the Major League Baseball team, National League team, and the National Hockey League team. And he looked at me and told me the same basic things. And actually, I'm thank you for that. Yeah. I saw him before I saw Dr. Mark Wells, the chiropractor. They were going to put metal rods in my spine. So cut me open and do a surgery to put metal rods in my spine to correct the scoliosis. But the drawback to that, I'd never play baseball again because I wouldn't be able to turn my head. I was like, well, screw that. At 24 years old, that's not an option. And this was a phenomenal doctor. This was the team doctor for the San Francisco Giants and the San Jose Sharks. And so he wasn't a slouch. The guy knew what he was doing, but he had a very narrow approach. So I didn't have an orthopedic problem. I had a posture problem. And he could correct my orthopedic problem with surgery and metal apparatus, and I could be bionic, I guess. Or we could correct posture from a doctor who specialized in correcting posture. That made all the difference in the world. And I don't have a scar. I don't have any metal. And now this is 32, almost 32 years later. Well, Dr. Mark Wells changed the entire trajectory of my life. I became a chiropractor because of him, because of what happened in his office. And not only did I felt better, I was thinking clearer. I was able to, and this is another, baseball, I improved my batting average by 40 points.
Wow.
And I've been playing baseball since I was 6. So for 18 years, I've been playing that sport. And in one season, going to Dr. Wells, I improved my batting average by 40 points because I had better hand-eye coordination because my spine was in a more optimal alignment. I thought, this is insane.
Yeah, we're going to have to send this episode to Dr. Wells.
Yes.
We're going to have to. Thank you, Dr. Wells.
But it changed everything about my life. Not only that, it changed my professional career and changed what it changed everything in my life. Posture literally is the window to your wellness. And I understood that directly. And based on that, once you establish whether you have a postural abnormality or not, it can be corrected. It just, and the why it's so important to be corrected. And I'm going to share some stories in my practice. I remember I had so many people coming in that were, the husband had a normal sperm count. The woman had normal amount of eggs. Her menstrual cycle was different. Maybe one day it was 18, or 1 month it was on the 18th day that she started bleeding. The other time she might skip a month. And then maybe on the 32nd day, it was just all over the place. Very, very strong indicator of abnormal problems. It was a random menstrual cycle. Menstrual cycles should be very, very routine and specific like clockwork. If it's not, it's a very strong indicator of postural abnormalities, which could also lead to infertility, because if there's not proper nerve supply from the brain, down the spinal cord, down into the lower back, to the ovaries, to the uterus, an implanted fertilized egg may not have the viability of survival because the nerve supply there and the information exchange from the brain to the body is not what it could be.
Yeah. I want to take a pause. I want to take a pause here really quick, guys, because this is a really huge deal. We're talking about couples that have tried so many different things, including infertility drugs and treatments to be able to get pregnant because they wanted children so desperately. Who do you know? Who do you know that's going through that right now that doesn't know that their posture might have something to do with it? So please, when you listen to these episodes, don't just be listening for yourself. Be listening for those people that you might know that need to hear this information. So please listen closely to this story because it is, I've cried over it. I've known some of these people and they're babies now.
Yeah,
It's amazing.
One situation, one story just stands out. Actually, I'm going to share two. One about infertility, one about bedwetting. Mm-hmm. I was the chiropractor for Powerhouse Gym. These are bodybuilding gyms, heavy weightlifting gyms, and I would teach their trainers about abnormal posture, how to spot abnormal posture. Because when somebody is in a gym, let's say they're doing heavy leg day on the squat rack, and they've got 400 pounds on their back. When they go down and do a deep squat and they're coming up, if their posture is off, the firing of the glute muscles, the hamstring muscles, the quad muscles as they're going up, and their low back postural muscles is off, which is when you've got 400 pounds on your back, you're dramatically more likely to rupture a disc. You're dramatically more likely to injure yourself when your posture is abnormal. So I was training the gym owners understood, and it was better for their liability insurance because they don't want any of their members getting hurt. But as I was training these trainers and training the owners to look, what does bad posture look like visually? How do you know if you've got a client that you're training and they're doing something, how do you know they're more predisposed to injury? Posture is everything. And as I was sharing this with their trainers, the owner of the gym, Mike was his name, He said, I'd like to have my posture and my wife's posture evaluated, because I was talking about neurologic function, not just how to prevent an injury in the gym, but overall body function. They came in, they were both, their postures were off, but in that, and I'm not going to mention her name or their last names, because I obviously don't want privacy, is very important.
And all
but
kinds of stuff.
What I found is they had spent over $60,000 on in vitro fertilization, where they took multiple of her eggs, fertilized them with his sperm, and implanted them, and they had done multiple rounds of that with no results. And the last time they had tried it, they implanted 6 fertilized eggs into her uterus. None of them took. So this came out in a very, very emotional, tear-shed moment as I was going over the findings of her specific x-rays and her evaluation and her posture evaluation. That's when the floodgates opened and all the emotions came out. Well, within about 6 weeks of evaluating her where she was, giving her exercises to do. So for example, it's called a mirror image exercise. So if I present with a high shoulder, the opposite of this, the mirror image, is a high shoulder on the opposite side. Doing an exercise in this position, because that's the normal presentation, doing exercises in this position retrains the back of the brain, the cerebellum, so that the end result is level shoulders.
I remember.
And doing all of that. Yes. So if you have a high right shoulder, that's your postural issue. Doing exercises with a high left shoulder to strengthen the shoulder muscles is the way to retrain the cerebellum, the back of the brain, which is, if you've ever wondered why they have people that are drunk walk a straight line, stick their fingers out and touch their nose, they're checking to see if the cerebellum balance and coordination is interfered with so much because of alcohol. That is exactly the point. You can be without no alcohol, you can have abnormalities because of posture. So it's not alcohol induced, it's neurologic induced because of bad posture. Well, it was after about 6 weeks, she started feeling much better. Her cycles, and she had she would go 2 to 3 months without a menstrual cycle. Then she'd have, like, on the 20th day, she'd start bleeding, miss a couple months, and then 35, 40 days after her last cycle, start bleeding. And so it was totally abnormal. It started falling into a very predictable pattern. After about 6 weeks, she had one, and then the next week was, I think within 1 or 2 days, the 3rd month, she didn't have one. And they were waiting, and this was not abnormal, but because the other 2 were in pretty close succession, she was feeling much better. She just had a totally different countenance about herself. They went and had a pregnancy test, and she was pregnant within 3 months of being under care in my office. Now, was the posture corrected? No, but it was on its way. And she took that baby full term. They now have 4 kids. Woo-hoo. All normal, all single sperm, single egg. They came together, not multiples. Not that they didn't really necessarily. They would take sextuplets if they could have children, but none of that worked. But they have 4 amazing kids, all born individually. And it wasn't because I'm a master doctor. Her body was the master healer. We just got it back into proper posture so the brain and body could function again, specifically with regard to the uterus and fallopian tubes, to regulate her cycle, regulate her birth process, and regulate the function between the brain and the uterus. Amazing. Well, another story I want to share you much quicker. 12-year-old kid came into my office because of his parents. Never had a dry night in his life. And most days at school, not only would he lose bladder control, he would also lose bowel control. And this was 12-year-old kid.
12 years old, guys, in school. Can you imagine this?
7th grade kid. Imagine the teasing he gets from his peers, because his mom would have to come down once or twice a day to bring fresh clothes, because he would be sitting in class and not know that he was losing bowel or bladder control. The students around him would see the puddle on the floor or smell the aroma. And that would be the indicator, or he would smell it himself. Now, can you imagine being that child in a public school system, the shame and the ridicule that he wanted to sleep at he said his number one goal was to stay the night at a friend's house at 12. And I was like, okay. We took x-rays of his lower back. His lower back was abnormal in alignment. His weight scales bilaterally, left or right, were off. And his posture was off, because it starts at the foundation. The pelvis is your foundation. The lower back and everything else starts to adapt as it starts moving its way up. Within 2 weeks, he had his first dry night in 12 years.
It's amazing.
Within 3 weeks, he had his first, where he's actually started to feel the sensation of a full bladder and go void it himself. And it wasn't that he had any injuries. There was no injuries in his life. There was multiple injuries, learning to walk, learning to skate, falling off his bike. All of these little things compounded created a major problem. And within, I went to, that was back, I don't remember what year it was, but he had his high school graduate. When did Caitlin graduate from high school?
Oh, I don't know. 2006
years ago?
13.
2013.
The same year we got married.
So he met this kid when he was 12. 2013, he graduated from high school, surrounded by friends. None of them were shaming him. None of them were ridiculing him. And from the time he was 12 years old all the way, he had full voluntary control of his bladder and of his bowels. And he almost had surgery multiple times, not to correct his back, to fix it, they said his bladder was too small. None of us have a bladder that's too small. None of us do. But the doctors didn't know what they were doing. He had been on every kind of monitor to try to tell him when he was going to wake, to tell him when he's about to have a dry night or a wet night to wake up. None of it mattered. But because it wasn't the issue. The posture was the issue. Correcting it changed this kid's life forever. Can't tell you what it's like when he came home and told me, or came back and told me he spent the night at a friend's house for the first time in his entire life at 12 years old. And the elation and joy he had on his face, that's the power of posture. Yeah. That's the power of wellness when the posture is normalized.
And you know what, guys, what we want you to know too is that you don't have to have a big event that creates a trauma in your life for you to have bad posture. Think about how you came into this world. Coming in through the birth canal itself is traumatic. And the neck gets twisted a lot of the time. The body gets pulled on. And so this is something that you should be thinking about no matter what age you are as a human being. And if you have small human beings that you're responsible for, you should be considering this for them as well.
Yes.
But what we want you to know is that you also need to make sure that you go to the right place for the care, right? I mean, because there's only one doctor out there that is a professionally trained spinal care and posture corrector, and that is
a chiropractor.
A chiropractor.
Yeah. But it's a subspecialty within chiropractic. Not every chiropractor assesses posture and or corrects posture. In fact, the majority of them do not. About 10 to 15% of chiropractors do what the type of care that I was sharing with you to do. So there is a database, there is a website where you can actually look in your geographic area and see if there's any doctors that do that kind of work to correct posture. So if you have a child, I'll just put it, when my children were born, literally within seconds of coming out of the womb, I checked them and adjusted both of them, and both of them had upper neck misalignments because the doctor pulling on their heads. It's also the number one cause of tubes in ears of kids, chronic ear infections, the top bone in the neck being misaligned. So check that. But the website,
by the way, guys, if you want that website, just go to dondiandmarcy.com, and through the contact us option, just ask for that website and we'll be able to get that out to you. Just it's easier, and then you know that you've got it right and you don't have to re-listen to it over and over again. So just send us a message there, because we absolutely want to get you that link to the right database there. Because you also need to make sure that not only are you going to the right doctor, but then that you're committed, that you're committed to following the care plan that they put in place for you, because your bad posture happened over time. It didn't happen. Well, for some people, if you were in a car accident, that sort of thing, it can absolutely have an immediate onset. But the majority of the time, your posture issues have come along over years. Yeah. And so make sure that you give your care plan the amount of time necessary for you to get the correction that you want for your optimal wellness, guys. Okay. So much great information in this episode. Thank you so much for your expertise and sharing those stories. Guys, thank you for joining us on this. It's a big one on episode number 20.
I know.
Episode number 20.
Episode 20 on the road.
It's amazing. So again, happy Good Friday to all of you out there. And thank you for being here for episode number 20, all about posture, the window to wellness. And we appreciate every single one of you. Please share this with at least one person, because somebody that you know needs to know about the importance of their posture. But we love you guys. We appreciate every single one of you. And we will see you for episode number
21.